theme selected for this year is Integrated Health Futures Addressing HIV, Non-Communicable Diseases and Comorbidities in a Changing World. And this theme is not just timely, it is essential in that for us in uniform, health is not just a personal issue, but a matter of operational readiness. You will agree with me that a healthy force is a ready force. More so in this era where the health challenges we are facing are more complex than ever before. Over the past 2 decades, we've made remarkable progress in the fight against HIV. Within our armed services, our uniformed services, prevention and treatment programs have expanded significantly. This is a real achievement that translates into more of our personnel living longer and enjoying healthier lives.
Let me thank you for allowing us to be part of this important meeting. The National Breast Council values its partnership with the Zimbabwe Defense Forces. I understand it's now the 13th anniversary. We believe this is in line with our mandate of coordinating the multi-sectoral approach to the HIV response. I just wanted to update the House that we are in the period of 2026 to 2030, where we are now developing the Zimbabwe National HIV/AIDS Strategic Plan. So, as National Health Council, we provide leadership in the development of the plan which guides the country and the program. And we do a lot of consultations, like I've said, and amongst them, the Zimbabwe Defense Forces is part of that. It's important to know that we are developing this strategy against the background of having achieved the 2025 targets of 95, 95, 95. However, the strategy takes note that there are critical gaps, especially in children. The mother-to-child transmission is still high, above the target of less than 5%. Pediatric treatment is still low. And we have what we call key populations. There are still disparities amongst those. And in the new strategy, we aim to address that. Zimbabwe is among the countries which have committed to accelerating the ending not only of HIV, but hepatitis B and syphilis in children by 2030, the so-called triple elimination strategy.
So, we do know that when you decriminalize sex work, you improve the working environment for the sex workers or the people in any case, in any work or in any trade. Safer working environment is associated with good occupational health. So it's their occupation, and within their occupation, the highest risk is HIV transmission, gender-based violence, and other things. So when you decriminalize, you make sure that their environment is safe. That's first. The second issue is when something is criminalized, people tend to go underground. So if they go underground and infections are continuing to occur, then that is not good, amongst others. And evidence shows that by just decriminalizing, you can reduce HIV transmission by 30 to 40%. So there is evidence for that.
As we depart from Blawayo, let us carry with us not only the knowledge we have gained, but also a renewed determination to transform that knowledge into meaningful action. The true success of this conference will not be measured by the quality of representations we have had, but by the tangible improvement we implement within our respective institutions. Let us therefore leave this conference inspired to strengthen our partnerships, improve the health and well-being of our personnel, and build resilient, inclusive, and innovative health systems that will serve both present and future generations.